Today I'm going to talk about breastfeeding. What is breastfeeding? How essential it is? How can we promote breastfeeding? And is it compulsory? Okay. So breastfeeding is a remarkable process. It brings a profound connection between the mother and child. It is physical, emotional and hormonal interaction. It's a beautiful process and it helps in providing all the nutrition the baby requires for the first 6 months of life, to the extent the baby may not require water also. So how does breastfeeding happen? How does it work? Breastfeeding happens by a demand and supply mechanism. So what happens is when there is demand, the milk production increases. When this demand reduces, automatically over a few days the supply reduces. What actually happens is when the baby sucks on the nipple, it sends signals to the brain which causes release of hormones, prolactin and oxytocin, which in turn helps the ducts in the breast to release milk and let down the milk. This is what happens with breastfeeding. So how do we promote breastfeeding? Breastfeeding is best done in a calm and comfortable environment. That's what promotes breastfeeding. Secondly, breastfeeding requires practice, support and knowledge. So if it's a confident mother who has right position, proper latching techniques, is in a calm environment, she eats regularly at regular intervals, healthy food, has adequate rest, has caregivers, is more successful in breastfeeding. However, along with that, there are always times of frustration, anxiety, which comes about, and during which we just need to support the mother through it. There are times when, for various reasons, including improper latching techniques, bites on the nipple, maybe the mother doesn't have adequate sleep, she's very anxious, disturbed, some amount of postpartum depression. These factors tend to reduce the milk output and then she struggles for breastfeeding. Women in these scenarios should approach lactation consultants, healthcare providers and support groups for help to establish breastfeeding. However, one should remember that breastfeeding is not the sole bar on which the worth of the woman is decided. Every woman's journey of breastfeeding is different. So, it is good if she exclusively breastfeeds. It is perfectly okay if she pumps and supplements with formula or she opts for formula feeding. What is most essential that she feels loved and cared, and so does her child, feels nurtured, loved and cared. I only want to drive this point that breastfeeding is beautiful. It brings about an emotional connection. It is important and it has numerous benefits. However, you and only you can decide what is best for you and your mental health, and that is most important. Thank you.